with Rafael Grossmann, MD, FACS. Your card's a surgeon, speaker, healthcare technology innovator with Eastern Maine Medical Center up in Bangor, Maine. The focus of this conversation is going to be on Google Glass. And so just to get us going here, could you kind of tell me how you got involved with Google Glass, how you got started?
Well, Eric, thanks for having me, first of all. I, as you said, I'm a surgeon, first of all, but I've been passionate about innovation in technology to help the way we give healthcare and we do medical education. So I got involved with technology years ago with telemedicine, and in 2011 I was blessed to do a TEDx talk on the use of iPod Touch to do telemedicine for acute care consultations in Maine. And I got a lot of press, and then I started using Twitter and LinkedIn, and started a blog, and then I ended up doing a sort of a course at Singularity University in Silicon Valley actually February 2013, and the formerly called the Future Med program, now called Exponential Medicine. I was there for 7 days with 80 other people. Very few of which were physicians, unfortunately, but a lot of people and healthcare-related people. And we were there for, I said, 7 days, exposed to incredible technology, incredible exponential technology. One of those technology pieces was on Google Glass. We had Babak Parviz, who was the inventor of Google Glass, one of the inventors of Google Glass. He talked to us about that new device, and he had it on, and immediately I had this wow moment where I saw incredible. You know, I've been thinking about bringing telemedicine from the big screens to the mobile devices, and suddenly this guy is telling us, you know, you have this frame that you put on your forehead, and you have a computer in front of your eyes, and you can do anything you can do with a smartphone or a computer with this. And I immediately cornered him, and he told me about the If I Had a Glass, you know, hashtag program. I applied very early. I got my pair of Google Glass with the argument I had about using Google Glass for telemedicine, for teleconsultations, for medical education. And the next day after I went to pick up the glasses, I had a conference lined up at Doctors 2.0 in Paris, conference that I attend every year. And I gave the first probably medical conference on Google Glass. I didn't even know how to use them yet. It was next day, and I couldn't put them on the internet in Paris. But anyways, people got really excited about it. And when I came back to the States, I thought of really putting them to use, and so I selected a case, and I got permission from the patient and the family for a simple case, and I ended up streaming an operation to an iPad nearby with a couple of students watching and connected with me virtually through the Google Glass, seeing my point of view of the operation, asking questions, answering my questions, so virtually in front of the patient doing the procedure with me. And I blogged about that I posted about that in my blog, and that got a lot of attention. And the video sort of went virally, or the video, or not so the video, but the story went virally through Forbes. And that was the first time Google Glass ever was used to do an operation inside the operating room. So that was sort of the beginning. And after that, I started sort of building on this passion for technology innovation with wearable devices, and specifically with Google Glass. And I've been lucky to go around the world as a speaker and sort of a consultant, advisor for startup companies and big conferences like EMMC, Asia Pacific, for example, recently, and a disruptive technology innovation in Berlin, and a number of other conferences. I've been lucky to really travel to almost every continent out there in the last year, talking about the potential for this incredible device as the first step to help us do better care, to do better medical education.
Let's talk about that potential. Where do you see the best uses of Google Glass in the provider environment?
Well, I always say that Google Glass is really the first step in the natural evolution of the device. It's not the perfect device yet. It's the first step. But it has set I think almost the standard for what a wearable device, a really wearable device, not something that we held or something that is in front of our eyes, that without touch, without having to use our hands, allow us to integrate with a digital realm, with an electronic medical record, which is now the standard in the industry for recording healthcare interactions. So the same way that we use a computer or a laptop or a tablet, you know, Google Glass has a screen in front of our eyes that we can look up like we look at the rear view mirror and access information. Now, that has been done, is being done, integrating Google Glass with the electronic medical record. I think that anything that we can do in an electronic manner in the healthcare realm today, we should be able to do with a wearable device like Google Glass very soon. So there's really no limit to what we can do with something like this, because, you know, I can record an interview, I can record an operation, I can stream an operation, I can ask for a teleconsultation to go through, you know, and stream my view of what I need answered to someone anywhere as long as there is connectivity. I can maybe connect with a patient through Google Glass, or a patient can connect with me streaming a question about a lesion or a body part. So from patient to provider, connecting the two, you know, the settings, or a provider to provider asking for consultation or teaching, or connecting with medical students, or trying to learn from an expert remotely. I think the possibilities for this electronic marvel is really only limited by our creativity, I think.
What are the limitations? You know, what shouldn't you be doing with Google Glass?
Well, I think that Google Glass it's another electronic device that allows us to connect and communicate. So just like we learned to do with smartphones or with cell phones, you know, when they started having cameras, you have to use your moral judgment, your personal ethics to limit what you do. I mean, you shouldn't be recording without permission. You shouldn't be streaming without permission. You shouldn't be doing anything that you wouldn't do in real life. You know, I think it's sort of it follows the basic rules that any other device should follow. At the beginning of the Google Glass hype, you know, people really started getting really nervous about people being recorded, or people recording with Google Glass. But, you know, the same thing happened with smartphones. You know, if everyone had the smartphone inside a bathroom, you know, and then the people get, you know, alarmed that someone was filming something or taking a picture. If you're in a movie and you're recording the movie with a smartphone, you shouldn't do that, and you shouldn't do that with Google Glass. So I don't think it adds any different set of responsibilities. It's the same responsibilities that you should have with any electronic device that allows you to establish connectivity and communication in a remote fashion and record in a remote fashion. So,
And we're starting to see some vendors come out and working specifically with Google Glass. What are some of the more unique uses for Google Glass that you're seeing some of these vendors come up with? I know we talked a little bit about augmetics and some of the stuff going on at Stanford, Beth Israel here in Boston. There's a couple vendors down in Texas, I believe, and then also we mentioned Singapore and other locations around the world where Google Glass is. Yeah. You're starting to see it come up in the provider setting, and there's some really interesting new ideas for how to use Google Glass. What are some of the more intriguing ones that you see right now?
Well, as you said, there's a few or maybe several vendors out there, young companies, usually startups that are almost not startup anymore. But Augmetics, for example, their idea was brilliant, and I had the pleasure to meet them, Ian Shaquille and Pelu Tran, almost a year and a half ago, and they told me a little bit about their idea, and I thought it was brilliant, and now they're making it happen. They're using Google Glass. At least one of the uses is to basically stream the interaction between a patient and a provider, stream that interaction through Google Glass to a remotely located scribe, so that when the provider finishes the interview or the interaction with the patient, the provider, you know, says goodbye to the patient, goes to the computer, to the electronic medical record, and all the information that is pertinent from that streaming of audio and video data is already in the computer. and it is edited, and all you have to do is review and sign. That's my understanding of what they're doing. I've seen a little bit of a showing of that, and I think it's brilliant because it potentially can save a lot of time. It potentially can decrease the potential error from not remembering what the patient said or what you ordered, or so it really helps you again improve that interaction by streaming the information through a device like this. People out there like Droiders, like Pristine, like a Third Eye, like connected context surgery. They are creating a HIPAA secure applications to stream video or stream data, and that is obviously very important. A Google Glass, at least in the healthcare setting, will never work unless we can assure that you meet the federal standards to keep patients' privacy, patients' information private, HIPAA compliant, and now that is almost a thing of the past. When Glass started, one of the big things in the healthcare was that it wasn't HIPAA compliant, and people got really nervous because you could do a hangout and connect to people by audio and video, but that wasn't up to the standards of the federal government because you go through Google. So in theory, Google would have access to that interaction, but and that's that got a lot of negative press. But very soon after that, then companies started appearing. The industry started producing the apps that we needed to do the same connectivity, but in a HIPAA compliant fashion. So when I even thought about using mobile devices like iPod Touch and then smartphones to do teleconsultations for trauma, that was the first time that was ever done. We did it at Eastern Maine Medical Center. I had that TED Talk, TEDx Talk in 2011, and I thought of using FaceTime initially when I heard about the iPhone 4. Wow, that would be great to connect. Just like I connect with my folks in Venezuela by video, why can't I connect to the doctor in St. John's or Madawaska or Calais from my smartphone, rather than a big system, computer, screen that it costs a lot of money and needs a lot of money to maintain. So FaceTime obviously was not the right choice intuitively because it's open and it's not HIPAA compliant. Then we tried doing Skype in an encrypted fashion, and that wasn't designed for that, so that didn't work too well. Within months, the industry produced 3, 4, 5 apps that you download for free, and then you pay maybe a fee and connect. Same way you connect with Skype or FaceTime, but in a HIPAA-compliant fashion, which is what we're using now. I have an app in my smartphone that I can connect to a doctor in Calais or in Penobscot Bay Hospital or Penn Bay Hospital or Penobscot Valley Hospital, any of the 17 hospitals in our telehealth network from my smartphone, and in a HIPAA-compliant fashion. So that I think the industry will provide what we need if we ask the right questions.
We've talked about this as a data entry tool for physicians, as a communications tool. What are the benefits? Let me put it a different way. What do you say to a patient who's coming in and sees Google Glass and may be a little bit hesitant about a patient-doctor communication with Google Glass? How do you sell the patient on the benefits of Google Glass for that patient?
Yeah, well, interestingly enough, I think it was Augmedix, again, who many months ago did a survey on 200 plus patients, and they really had very good feedback from the patients in regards to this piece of weird-looking, frames in the forehead. Most patients, I can't remember the statistics, but most patients didn't mind. Most patients liked it. Anyone who tried them on was amazed because anyone who puts glasses on and looks at the little screen in front of the eyes is just blown away by the sensation of having a computer in front of your eye. But what I would say to the patient, I think that it also depends on what type of patients you're treating. If some patients might be very technophilic, and they might be aware of what Google Glass is, and they'd be maybe excited. Some of them might say, I don't want you to be recording me. I think most of them would probably not exactly know what you have in front of your face. And my good friend Denise Silver from Doctors 2.0 in Paris, she coined the phrase, I think it's her phrase, but last year I heard it for the first time. Patients, they want to be cured rather than secured. And I thought that was kind of a cool way to put it. I think patients want to be healed, they want to be helped, they want their problems solved, and whatever piece of equipment, be it a stethoscope or an electrocardiogram machine or a fancy ultrasound or a fancy goggles, they really want to be healed, and I think that would be my main argument. You know, this is something that is helping me take care of you, and you know, then we can go to the details of privacy and tell them, you know, I'm not recording anything without your permission, or whatever I record is going to be, you know, kept secured. So all those extra layers of argumentation, I think that are probably due at some point, especially if the patient requests them. But certainly privacy is the main thing, and after that it's all downhill. I think it's a tool that would help us provide better care in an easier way, in a more secure way. Not secure in the sense of privacy, but less errors. You know, I've talked in my conference frequently that you know, the numbers are astonishing. You know, 440,000 patients die in the U.S. a year due to preventable medical errors. And I think that a tool like this, with the potential to improve our connectivity and our communication, and somehow get a degree of artificial intelligence into it, like Google Now, for example. Like Google Now is a digital assistant. Well, Google Now for healthcare in glass, that would be amazing, where you can be alerted before you order a drug to which the patient is allergic to, or you be alerted of a low hemoglobin value on a patient that is going to get a blood thinner, or you know, things like that that could prevent you from doing harm to a patient, which we do very frequently in the United States and probably all over the world. It's amazing. Preventing wrong side surgery. The numbers also astonishing. You know, the statistics say that 40 times every week we do a wrong side surgery in the United States. 40 times a week. This is despite the fact that you cannot start a surgery in any patient, I think, in the United States before you have the site marked and the timeout, and you still do it 40 times. So imagine a device like this alerting you of you going for the wrong eye, or for the wrong breast, or for the wrong leg.
And this is still common, that they mark it with a magic marker on the body, to the side of the body that they have to do the surgery on, just to make sure.
It's a must,
Yeah.
And it still happens. Because you see, we rely on digital records, on electronic medical records. You know, we've been doing it for I think, almost 5 years. I think 2009, when the act came out, that we really wanted to improve on the care of patients. And despite 5 years and many millions of dollars, we're still not up to the standards. The information is inputted by humans. And when you have humans in the equation, you're prone to errors. You're not going to be error-free. So I'm not saying that the human needs to be out of the equation, but if you have artificial intelligence systems or deep learning systems or computerized systems that improve on what we can do, at least in that sense, that'll help us do less harm and commit less mistakes. If someone comes in and marks it right at the very beginning of the chain on the electronic medical record, and all I see is that, you know, person before me who marked it wrongly, marked it on the wrong side, that's going to be the side at the time of the surgery, and it happened that the first person on the chain was wrong, and it was actually the left side. So it's like pen and paper, despite, you know, all the years of advancement in electronics, you know, and we go, instead of writing, we type, and it's the same mistakes, but in an electronic fashion.
What's next for Google Glass? Where do you see the next big advancement being made?
Well, I think that there are going to be pretty interesting advances, and I'm confident that despite the bad press recently, in the last at least couple of weeks, there has been a spike on bad press for glass, and people saying that glass is going to be the segue of this era, and that kind of press. I think they're completely wrong. I think that Google Glass is the first step in the natural evolution of the device, from big computers filling up a room, to PCs, to laptops, to tablets, to smartwatches, to smartphones, to now glass. I think that is the first step, and I think the second edition of glass, which is due for sometime at the beginning of I just read yesterday of 2015. Someone said that a commercial version of glass was out, but I'm confident that the next version is going to be much improved. Battery life is certainly an issue, and that ought to be improved. I think that the internet connectivity, it probably needs to be improved. The fact that, for example, glass heats up when it's working hard, I think that's another issue. And I'm pretty sure that I know Google is going to do it right. I'm pretty confident that that's going to be the case. I think that the next version of glass, I see it as a more battery life, more connectivity, easier to connect to other sites, maybe easier to download apps to the actual platform, so you can interact easier without having to be a programmer to create an app to do your work better. That's probably going to be the next improvements, I would think. And I'm very excited. I can't wait to. I hope the current Explorers we get a sort of a pre-release or something, so we can put our hands on the units before they come out to the public. I don't think they're calling it commercial. I think because rightfully, I don't think Google Glass is probably ready for mainstream public yet, because it's an expensive device still, and I'm pretty sure the next unit is going to be much less expensive. But again, I don't think it's ready to substitute the phone yet. But I'm pretty confident that in the future you're going to have a device like this, similar to this, by Google or someone else, likely by Google, that will substitute a lot of smartphones out there. Because why would you be texting or doing this when you can just be a human and stand erect and have your data here rather than here or here on a smartphone? So I think that the next edition is gonna meet those criteria, those standards. And again, it's commercial because I think it'll be tailored to a specific group, professional group, at least at the beginning, probably for a few years. Healthcare, designers, musicians. You can imagine how a musician or a professional speaker might have a different need than a surgeon operating has, or a web designer or a photographer. I think that it'll be a device that really will augment the capabilities of a professional trying to do their job in an easier, more efficient way.